everyone. I am Afreen and welcome to today's lecture. Today my topic is going to be about evaluation and treatment of addictive behaviors. My topic will be covering the following 9 major objectives: continuum of care, substance use status and substance use care continuum, early intervention and populations who should receive early intervention, components of early intervention, principles of effective treatment, some key findings, treatments for drug addiction, behavioral therapies, and mutual help groups. So, let us begin with what continuum of care is. A coordinated system of care that leads and follows a patient throughout time as they navigate a wide range of health services catered to their needs. Preventive care, early intervention, treatment, follow-up care, and recovery support are all possible components of a continuum of care. In many medical and social contexts, mild substance use problems can be accurately and promptly detected. Guided self-change, often known as brief motivational treatments or supportive monitoring, is frequently effective in treating several prevalent but less severe diseases. In contrast, it is frequently necessary to receive specialized treatment for substance use disorders as well as ongoing post-treatment care in order to fully recover from severe, complicated, and chronic substance use disorders. A continuum of care offers clients a range of service options based on need, including prevention, early intervention, treatment, and recovery support to address the range of substance use issues and disorders. The majority of substance use disorder therapy has historically been delivered in specialty substance use disorder treatment programs, and these programs differ greatly in terms of their clinical goals as well as the frequency, intensity, and setting of care delivery. Let us talk about substance use status and substance use care continuum. The key behavioral, pharmacological, and service components of care and services that are available and emerging treatment technologies are all covered in this part, along with early intervention and treatment components of the continuum of care, which are early intervention, which helps avoid more severe substance use disorders by addressing substance misuse issues or minor disorders. For people who have a substance use problem but may not be ready to start treatment, treatment engagement and harm reduction treatments can assist them get involved in treatment and lessen the dangers and negative effects of substance abuse. Substance use disorder therapy, which consists of a customized package of professional treatments supported by scientific evidence and aimed at enhancing health and function. New therapeutic technologies are being employed more and more to help the evaluation, treatment, and upkeep of ongoing contact with the people with substance use disorders. Now, let us discuss early intervention, that is, identifying and engaging individuals at risk for substance misuse and substance use disorders. People with problematic usage or minor substance use disorders can get early intervention treatments in a variety of locations, such as school clinics, primary care offices, and mental health clinics. These services are typically offered when a patient arrives with another medical issue or a need for social services rather than to receive treatment for a substance use disorder. Early intervention aims to lessen the negative effects of substance abuse, to curb risky behaviors before they cause harm, to enhance health and social functioning, and to stop the onset of a condition and the eventual requirement for specialized substance use disorder therapies. Early intervention entails educating patients on the hazards associated with substance use, normal or safe levels of use, and methods for quitting or reducing use and use-related risk behaviors. When necessary, it also involves promoting patient start and involvement in treatment. Services for early intervention could be seen as the link between preventative and treatment programs. Intervention in these situations can be used as a tool to draw those with more severe substance abuse into treatment. Let us now talk about populations who should receive early intervention. Adolescents and adults who are at risk of or exhibit indicators of substance usage or a minor substance use disorder should receive early intervention. People who binge drink or those who have had at least 5 for men or 4 for women drinks in a single setting at least once in the previous 30 days are one category that often needs early intervention. Data from a recent national survey indicate that over 66 million people aged 12 or older fall into the category of binge drinkers. The 1.4 million 12 to 17-year-old binge drinkers are of special concern since they may be more susceptible to developing substance use issues in the future due to their youth. People who use drugs while driving and pregnant women are two more populations who could benefit from early intervention. In 2015, it was estimated that 109,000 pregnant women took illegal drugs and 214,000 pregnant women drank alcohol. The available research demonstrates that brief early interventions delivered by a trusted care provider such as a nurse educator, or doctor in the course of routine medical care, for instance, a regular physical examination or treatment for an injury or illness, can inform and inspire a large number of people who are abusing substances to recognize their risky behavior and reduce their use. Identifying behaviors that place a person at risk for injury or for developing a substance use disorder is the first step in early intervention, regardless of the substance being used. Following positive screening result, brief advice or counseling should be given, tailored to the person's particular issues and interests and given in a non-judgmental manner. This advice or counseling should stress the significance of reducing substance use as well as the person's capacity to do so. If the screening and brief intervention were successful in bringing the substance use down to dangerous levels, subsequent follow-up monitoring should determine whether the person requires formal treatment. Now, let us move towards another objective, which is components of early intervention. Screening and brief intervention is one systematic strategy for providing early intervention to persons exhibiting early indicators of a substance use disorder or substance usage. According to research, a number of screening and brief intervention techniques can successfully reduce at-risk substance use in a range of patient demographics and healthcare settings. As was already indicated, this research has showed beneficial effects for lowering alcohol use. However, research using screening and brief intervention among persons with other substance use problems has shown conflicting findings. Additionally, research demonstrates that screening and brief intervention may be economical. Drug addiction is treatable, but it's not an easy process. Most patients require ongoing or repeated care in order to completely stop using and rebuild their life. Addiction treatment must help the person do the following: stop using drugs, stay drug-free, and be productive in the family, at work, and in society. Chemically dependent patients are frequently categorized by therapists as either interested in changing or uninterested in changing. A whopping 40 to 60% of Americans with substance use disorders who seek treatment relapse within a year. Treatments typically involve making plans for specific ways to stay away from the addictive stimulus, as well as therapy sessions aimed at teaching the patient healthier alternatives to satisfy their needs. In recent years, clinical leaders have made an effort to customize intervention strategies to particular factors that affect addictive behavior. They have done this by using therapeutic interviews to learn more about the circumstances that led a person to turn to unhealthy, addictive sources of pleasure or pain relief. Moving forward to another objective of my topic, which is principles of effective treatment. Based on scientific research since the mid-1970s, the following key principles should form the basis of any effective treatment program. And the first principle is the disease of addiction, which has an impact on both behavior and brain function, is complex yet curable. Second principle states not everyone responds well to the same treatment, and people should have easy access to medical care. Next states, treatment that is effective takes into account the patient's overall requirements, not simply their drug usage. Another principle is, it's important to complete your treatment program. The most often utilized types of therapy are counseling and other behavioral therapies. And the next principle states, medications are frequently a crucial component of treatment, particularly when used in conjunction with behavioral therapies. And to accommodate the patient's evolving demands, treatment regimens must be often evaluated and updated. Other potential mental problems should be addressed throughout treatment. Detoxification with medical assistance is merely the beginning of the healing process. Treatment is still effective even when it is not voluntary, and drug use must be closely monitored during treatment. And the last principle states, patients should be tested for HIV/AIDS, hepatitis B and C, TB, and other infectious diseases as part of treatment programs, and they should be educated about preventative measures as well. Now let us discuss another objective, which is some key findings. Recurrence rates for substance use disorders are comparable to those for other chronic conditions like diabetes, asthma, and hypertension, according to strong scientific data. With thorough continuous care, recovery is now a possibility, and only 1 in 10 individuals with substance use disorders receive any kind of specialized care. The majority of treatment has taken place in specialized programs for people with substance use disorders with little to no involvement from primary or general health care. However, there is a change underway to mainstream early intervention and treatment programs into routine general medical practice. Despite having strong scientific support, medicines are underutilized even though they are capable of treating severe substance use disorders. 3 drugs for the treatment of alcohol use disorders and 3 drugs for the treatment of opioid use disorders have received Food and Drug Administration approval in the United States. But not enough doctors in active practice or treatment programs currently offer these drugs, except for the pharmaceuticals already mentioned for alcohol and opioid use disorders. There are currently no FDA-approved medications available to treat marijuana, cocaine, methamphetamine, or other substance use disorders. According to supported scientific evidence, substance abuse and substance use disorders can be reliably and simply detected by screening, and less severe versions of these illnesses frequently improve in response to brief medical guidance and other sorts of brief interventions. These quick interventions have been shown to be successful in treating mild alcohol use disorders according to scientific research, but there is currently only preliminary data to support their use in treating drug use disorders. Supported scientific data demonstrates that receiving treatment for substance use disorders, whether inpatient, residential, or outpatient, is more cost effective than not receiving it. Treatment for substance use disorder shares many of the same core objectives and general management strategies as other chronic illnesses. The goals of treatment are to improve health and functional status, lessen problematic levels of major symptoms, and address co-occurring substance use disorders and other psychiatric diseases. Medication, behavioral therapy, and recovery support programs are important aspects of care. Behavioral therapies can be successful in treating substance use disorders according to strong evidence. However, the majority of evidence-based behavioral therapies are frequently utilized insufficiently and with low fidelity. When compared to non-evidence-based therapies and services, treatments using these evidence-based practices have demonstrated superior results. And another finding is there is promising scientific evidence that some electronic technologies such as the utilization of telehealth and the use of electronic health records could enhance access, engagement, monitoring, and ongoing supportive treatment for people with substance use disorders. Let me bring your attention to another objective of my topic, which is treatments for drug addiction. Treatment for addiction is not universal. Your needs may dictate different treatments. Depending on the substance you abuse, the degree of care you require, your unique mental health requirements, or the cost of your medical options, you can select the treatment that is most effective for you. There are many options that have been successful in treating drug addiction, including behavioral counseling, medication, medical devices, and applications used to treat withdrawal symptoms or deliver skills training, evaluation, and treatment for co-occurring mental health issues such as depression and anxiety, and long-term follow-up to prevent relapse. Success may depend on a wide spectrum of care, a personalized treatment plan, and available follow-up choices. Medical and mental health services should be used during treatment as necessary. Community or family-based recovery support networks may be included in post-treatment care. Residential treatment, including inpatient or outpatient, neighborhood support groups, long-term care facilities, recovery or sober homes, addiction counseling, mental health services, and medical care are just a few of the programs that can aid in drug rehabilitation. Age and gender-specific programs are offered by several treatment facilities, and one such treatment is drug or addiction counseling. Drug rehabilitation is the process of treating a person's dependency on psychoactive substances such as alcohol, prescription medications, and illicit drugs like cannabis, cocaine, heroin, or amphetamines using medical or psychological means. The main goal is to provide the patient the tools they need to address any substance dependence they may have and stop abusing drugs so they don't suffer the negative psychological, legal, financial, social, and physical effects that can occur, especially with severe abuse. In many drug rehabilitation programs, psychological dependency is addressed by attempting to educate the client new ways to interact in a drug-free environment. Patients are often advised to avoid hanging out with friends who still use the addictive substance and may even be obliged to do so. It is also underlined that complete abstinence is preferable to attempts at moderation, which could result in relapse. One is too many and 1,000 is never enough when it comes to legal drugs like alcohol. It is still debatable whether people with a history of abuse can learn to be moderate. Another treatment option is detoxification. You can detox from addictive substances in a secure setting with medical assistance. This is advantageous since unpleasant or even life-threatening physical symptoms of substance withdrawal might occasionally occur. Detox is frequently combined with other therapy because it does not address the underlying behavioral causes of addiction. The next treatment option is step facilitation. Alcohol and drug misuse can be treated with a 12-step facilitation treatment or 12-step program. It is a type of group treatment that acknowledges that addiction can have a number of detrimental effects, some of which can be social, emotional, spiritual, and physical. This kind of therapy starts with acceptance, progresses to submission to a higher power, and finally moves on to participation in regular group meetings. Group meetings are used in popular programs like Alcoholics Anonymous for discussion and support among members. Another treatment option is treatment with medication. When used in conjunction with behavioral therapy, medication can be crucial to recovery. There are several drugs that can help with cravings, mood, and addictive behaviors. For instance, the FDA recently approved lofexidine to help patients undergoing treatment for opioid addiction by lowering cravings and withdrawal symptoms. Drugs like acamprosate can aid in lowering alcohol consumption. Let us move forward to another objective of today's topic, which is behavioral therapies used to treat drug addiction. Behavioral therapies help patients to modify their attitudes and behaviors related to drug use, increase healthy life skills, persist with other forms of treatment such as medication. Patients can receive treatment in many different settings with various approaches. One such approach is outpatient behavioral treatment, which provides a broad range of services for clients who regularly see a behavioral health counselor. Most of the programs involve either one or both of individual or group drug counseling. These programs often provide behavioral therapy in the form of cognitive behavioral therapy, which aids patients in identifying, avoiding, and resolving circumstances where drug use is most likely to occur. Next is multidimensional family therapy, which tackles a variety of factors on adolescents' drug misuse habits and is intended to enhance overall family functioning. This therapy was developed for teenagers with drug abuse problems as well as their families. Another one is motivational interviewing, which takes advantage of individuals' willingness to alter their behavior and seek treatment. The next is motivational incentives, which promotes drug abstinence via the use of positive reinforcement. Patients may initially receive extensive treatment, attending numerous outpatient sessions each week. Patients move from intensive therapy to normal outpatient care after finishing it, which meets less frequently and for fewer hours each week to support ongoing recovery. Let us discuss various behavioral therapies in detail. Since 1932, a variety of aversion therapy techniques have been applied to the treatment of drug and alcohol addiction. Disulfiram, a medication occasionally used as a second-line treatment under proper medical care, is one method for treating alcoholism that has been incorrectly labeled as aversion therapy. Disulfiram induces sensitivity comprising extremely unpleasant reactions which can be clinically severe when a person consumes even a modest amount of alcohol. To create an aversion for cocaine dependence, emetic therapy and ferritic aversion therapy have both been employed. It is unknown if rapid smoking, a sort of aversion therapy used to provide an unpleasant stimulus, can assist tobacco users resist the impulse to smoke. In order to help people change their behavior or inner experience, covert conditioning is a method of mental health treatment that draws on the ideas of applied behavioral analysis or cognitive behavioral therapies. Patients who undergo cognitive behavioral therapy discover how their thoughts influence how they behave. They can create new behavioral patterns with the use of cognitive awareness, which alters their thought processes and emotional responses. It views the habit of smoking as a learned behavior that eventually develops into a coping mechanism to deal with everyday challenges. Smoking can replace other coping mechanisms because it is frequently available, provides immediate gratification, and eventually permeates daily life even during non-stressful situations. Cognitive behavioral therapy attempts to replace smoking with alternative coping techniques by focusing on the behavior's function, which can differ from person to person. It also seeks to assist those who experience intense cravings, which are a common cause of treatment-related relapse. According to a 2008 controlled study from Stanford University School of Medicine, cognitive behavioral therapy may be a useful strategy for maintaining abstinence. Over the course of a year, the outcomes of 304 randomly selected adult participants were monitored. Some participants in this program received medication, cognitive behavioral therapy, round-the-clock phone help, or a combination of the three techniques. At 20 weeks, the cognitive behavioral therapy participants had a 45% abstinence rate compared to the non-cognitive behavioral therapy individuals' 29% abstinence rate. According to the study's findings, individuals can develop the skills necessary for long-term smoking cessation by focusing cognitive and behavioral strategies to support smoking cessation. According to studies, cognitive behavioral therapy is a successful treatment for substance misuse. Cognitive behavioral therapy tries to replace unhealthy narratives with maladaptive beliefs such as denial, minimizing, and catastrophizing thought patterns in people with drug addiction problems. According to research, cognitive behavioral therapy is especially beneficial when used in conjunction with other therapy-based therapies or drugs. The technique depends on a person's ability to employ imagery for things like mental rehearsing. It is believed that rigorous use of behavioral treatment concepts such as a comprehensive behavioral analysis is necessary for effective covert conditioning. Another one is rational emotive behavior therapy. You might be able to identify your negative thoughts with the use of rational emotive behavior therapy, which can also teach you strategies for overcoming feelings of defeat. The purpose of rational emotive behavior therapy is to assist you in realizing that your capacity for rational thought is innate and unrelated to stressors or circumstances outside of you. The next is contingency management. Alcohol, drug, and tobacco addictions are only a few of the many addictions that can be treated using contingency management. By providing you with material rewards, contingency management therapy supports your beneficial behavior, that is, keeping sobriety. According to the National Institute on Drug Abuse, this kind of therapy has been utilized to prevent recurrence. Now we'll talk about inpatient or residential treatment, which can sometimes be quite successful, particularly for those with more serious issues, including co-occurring disorders. Licensed residential treatment centers provide intense care that is structured 24 hours a day, safe housing, and medical attention. Residential treatment centers may employ a range of therapeutic techniques, and they typically strive to assist patients in leading drug and crime-free lives after treatment. Residential treatment facilities include, for instance, therapeutic communities, which are extremely organized programs where patients stay at a house for a period of time, usually between 6 and 12 months. The patient's attitudes, understanding, and behaviors related to drug use are influenced by the entire community, including the treatment team and individuals in recovery. Let us discuss the last objective of my topic, which is mutual help groups. Members of a support group offer one another various forms of assistance, typically non-professional and immaterial, for a certain shared characteristic which is typically burdensome. When members with similar problems join together, they can share coping mechanisms, gain confidence, and develop a sense of community. The assistance could come in the form of offering and assessing pertinent information, sharing personal experiences, hearing about and accepting the experiences of others, demonstrating sympathetic understanding, and creating social networks. A support group might also advocate for causes or try to educate the public. Some support groups formally regulate membership through entrance qualifications and membership dues. Other groups are public and welcome everyone to attend meetings that are posted or take part in online forums. For instance, a self-help support group is entirely run and controlled by its participants, who are frequently volunteers with first-hand knowledge of the group's topic. Fellowships, peer support groups, lay organizations, mutual help groups, and mutual aid self-help groups are other names for these organizations. The most prevalent are self-help groups for mental health and 12-step organizations like Alcoholics Anonymous. Alcoholic Anonymous is a voluntary program for those suffering from alcoholism that is founded on the idea that rehabilitation has a spiritual foundation. Meeting attendees share experiences and talk about the 12 steps towards recovery. The advantages of abstaining from alcohol are explored. It is suggested to abstain daily or once a week. That brings us to the end of this topic. Thanks for watching.